Well, it's Groundhog's Day, and that can only mean one thing. Matthew Holt has emerged from his little hole in the ground to let us know what his prediction is for more funding in this next year for health tech companies. Will he see his shadow and be scared back into the hole? It looks like it. It's the February 2nd episode of Health Tech Deals.
All right, Jessica. I know I've seen the movie, but I don't understand it. So if the groundhog sees his shadow because the sun is up, there's more winter? But if he doesn't see his shadow because there's no sun, there's less wind, winter's end?
Yeah, it's early spring. Yeah, so if you see
why does that make any sense? Shouldn't the sun come up for spring?
Yeah, you have to think about it from the perspective of the groundhog. So you can't think about it.
Hang on, how does the groundhog see his shadow anyway? Unless he's turning it. Go on.
He comes out, he gets scared by himself, which has happened to the best of us, really. Let's admit it. Goes back in the hole, which means he's going to stay there for 6 more weeks, and that means 6 more weeks of winter. But if he comes out and it's cloudy and he doesn't see his shadow, he's like, this is cool, and then hangs out, and then it means an early spring.
That makes no sense to anybody.
Clearly, you're not having.
Hang on. So,
this was like an integral moment of the winter of like, oh God, I hope he doesn't see his shadow. I hope he's fine.
so the other question is, what has this got to do with health tech funding? If I go back inside,
you are our groundhog. So if you see your shadow, that's it. Funding dried up this year.
Oh God, maybe it's over.
If you don't see your shadow, which it was kind of dicey, we're going to have to look back at the footage. You were scared regardless, but you usually are, so I think it's okay. But yeah, if you don't see your shadow, then I think the funding climate is great. So folks are going to have to look at the Rock Health reports and see how you can correlate it with whether or not you saw your shadow.
Are you ready?
Yeah, let's go. League gets 95 million, brings their total up to 205. I thought this was a dating app. What is it?
It was a dating app too, which I think there's some other stuff like that going on in the next deals. It's some kind of like backdoor, front door stuff. They work with Humana and a bunch of plans and shops. I keep reading their stuff. I have no idea what they do. It's some kind of integration of data and stuff for consumer experience. It's Canadian. Must be nice.
Okay, in-home chemo provider Reimagine Care gets 25 million.
This is super clever, right? People go to get chemo all the time. And then you found out that there was a coronavirus. People didn't want to go to the hospital, so these guys said, let's do chemo in the house and send all the stuff there. It could be it's yet another different in-home provider. We've had Bentley Home and others, and Sunny Ventures, Martin Ventures, LRV are in this one. I think it's a good idea.
All right, more in the cancer space. This time is a French-based company called Resilience. They get 40 million euros.
Yeah, this is wacky to me. A cancer care management system has got a patient-facing and a oncologist-facing part. I did note that both the founders, between them, after doing this a year, have had zero healthcare experience before. Maybe they'll revolutionize French cancer care. Maybe not. 45 million euros says who knows.
Okay. How about Mantra Health? They get 22 million, brings their total up to 29. This is the founder, one of the co-founders of Tinder is leading this, right?
We're the lead.
Mental health for college kids.
But you're right, it's mental health for college kids, both for short-term treatment, also for long-term treatment aimed at college kids. It's a great market. A lot of need there.
All right, Physician Partners, $500 million is a primary care group in Florida.
So this is weird, right? $500 million from private equity company Kinderhook for Physician Partners. They have about 130 doctors on their system, about 135,000. Sorry, 500 doctors on their system, about 130,000 Medicare, Advantage, Medicaid, managed lives. They're about half the size of Kano, which went public and is now trading at about the valuation of about $1 billion, which has roughly 1,000 providers on the system and a couple of 100,000, I think it's a few more Medicare Advantage lives. So, I'm confused about this, other than the people who ran Physician Partners in Tampa came from WellCare, and literally they became part of Centene. WellCare got raided by the FBI a while back. Maybe this will happen to these guys too. Every time I see a new thing in Florida doing new managed care, Working with Humana and everybody else, I'm thinking, pretty
This is a front for something else.
I'm sure it's a front. I'm sure they're very nice people, but we'll see. We'll see how it goes. It is very strange, right? That the place which has the most chaos and the most fraud in healthcare, which is Florida, is now producing these, different. You have Kano, you have Chem, which isn't public yet. You have is it Apollo Med from there as well. Now there's another one, which are attracting all this funding, the public and private, to run medical groups. In the end, medical groups are very hard business, as you can see with the stock price of Oak Street Health and some others. I hope they do well because there's a need for better, more organized medical groups in Florida. Hopefully they're it.
Well, this was a motley little potpourri of deals. Are you scared?
Certainly was.
Are you scared of these deals? Maybe that's it. Instead of the sun, these were the deals we had today. Are you terrified by these deals? More funding, less funding? I don't know.
Pretty much. There was the couple we missed, including there's another psychiatry only network called Talkatry, which raised 17 million from New York, and there was there's all kinds of random stuff going on. I don't know. I don't. Probably it'll happen, but I think that the 500 million is weird, but it's a private equity deal. I'm not sure if we're going to see the flow that we saw at the end of last year and the latter part of last year. I mean, I can't see us reproducing that, especially in a marketplace where the publicly traded companies, although they've been going up the last few days, having gone down massive double-digit percentages in some cases, 2/3 to 80% off. Now they're going up 5-10%, but they're crawling back slowly with the rest of the stock market. I don't see the private companies. I think it will be another 6 weeks of winter, or me going back into my hovel or hole or whatever it is. I don't think we're going to be seeing the level of investment we saw while this all sorts of stuff out. Having said that, today I'm at a conference looking at venture capital, and I will talk to a bunch of venture capitalists in San Diego and figure out what they are saying.
Good. Find out what they have to say about the whole matter at hand here.
They're probably saying we can buy the same thing cheaper with all our extra money. On the other hand, they're all raising lots of money, so who knows?
I love how you always land on who knows. Great groundhogging there. At least Puxatawny Phil has like a definite prediction.
Either he's in or he's out, and I'm in the middle. Maybe it's 4 more weeks of winter.
Way to safeguard yourself from never being wrong. That's what this is all about. You can't say I was wrong. I didn't say anything at all. That's right, Matthew Holt. Sure didn't. For more of nothing, head on over to Twitter. Follow the guy at Bolty Boy. Those San Diego exploits should be pretty good to watch here. See those. And I am over at Jess DaMassa. And then you can, of course, sign up for the email newsletter over there at thehealthcareblog.com. And you'll get these episodes of Health Tech Deals, my WTF Health interviews, and all of the other content that is put up on the blog over the course of the week, delivered directly into your inbox.
Do I have to not do this again until next winter?
Yeah. Next time we're getting you a cute little top hat that you can wear.
Shouldn't you have the top hat and take me out of the box?
I need like that mayoral sash. That would be good for me. I would rock that.
You would. We'll get you a sash. Say goodbye.
Bye.